Moving on to new business, and we got the Director of our Health Department, Mr. Davin Madden. He'll come up front. 5 years anniversary today. And what, can it get any better?
Yeah, that's it. Well, good morning, Chairman Pate and Commissioners. I'm happy to be here before you this morning. I appreciate you allowing me a little opportunity. I'm here with Salita Graham. I just want to introduce her. She's not going to do the talking because she's new and we don't want to run her away because we just saw this wonderful celebration. I got my beautiful pen. It's a good testament to the work morale and enforcement here in Wayne County as an employee. I think that was a good invitation this morning. And I'm going to talk a little bit about that in my presentation. But this is Salita Graham. Just like to introduce her. She's our health education supervisor. And she was originally with us as a health educator for several years, did a wonderful job, and we were lucky to bring her back now as a program director. And she's actually did this presentation that I'm going to talk to you about. So I just want to make sure she has an introduction.
Good morning.
Good morning.
All right, I'm here today to talk a little bit about the community health assessment. This presentation, I'll try to be as brief as I can. Those of you that know me, that is a challenge. So I will keep a clock over here, and if it gets too long, feel free to throw anything that's not sharp in my direction. The community health assessment is something that we're required to do every 3 to 4 years by law. And what the community health assessment, do I have a means to trigger it, Karen?
No,
I have to just kind of
you have to look at, just point at me or nod or something.
We make sure I was ready to go forward. So it's what we do every 3 to 4 years, and it's the community's voice on health issues in the community. And when we talk about health issues, we're not specifically talking about blood pressure and jumping jacks. This is looking at those core foundational elements that drive the community's health, the perception of the community, and what it looks like to those that are looking from the outside as well as those that are being affected by it from the inside of the community. This talks about economic status, talks about crime rates, talks about access to care, and we'll get into a little bit of that. I won't go through all the little details here for you to respect your time, but this gives you kind of an overview of what it does. We quantify certain health issues in the community. We look and detect certain trends that we see, evaluate. We try to identify health inequities or disparities because those are where our resources should be directed towards. And we also look at a comparison with our peer communities as well, just to see where we kind of fit, kind of in a qualified position with some counties that have similar demographics, similar wealth, similar size, etc. Of the community health assessment. This is really a significant document that we do, and it's done in partnership, which I'll mention here in a moment and give them some recognition. But it's not just a health department endeavor. This is actually a partner collaboration that significantly develops a document that does these things right here. Increases the community awareness, and that's so critical for the awareness because we get tied up in our day-to-day operations, and sometimes we let slip by where should we be reprioritizing our resources, where should we be developing our strategic objectives. Once we look at those, we prioritize what we feel, and this is coming also from the voices of the community that we assess in this survey. Again, we do the identification, and then we try to look at evidence-based strategies as interventions and preventive measures to work on some of those targeted issues. But the overall goal here is improvement of the health status. And again, that's why I say it over and over again, and I don't say it because I just think that everybody thinks of it. But when you say health, typically everybody thinks of, again, my blood pressure, or what's the death rate due to cancer. And so health is really this large encompassed element of these drivers: education, jobs, safety, those elements. Just give a nod to our partners. This could not be done really as thoroughly as by the health department alone, because it is a quite extensive endeavor. But we partnered with East Carolina to do our statistical evaluation of our survey results. We partner, of course, with the hospital. The hospital is our big partner here. It's really not all counties partner with their hospitals. I think that they would be remiss if they did not, because when you're looking at the health of the community, we know that on the back end of healthcare, which is the treatment, mitigation, and response to healthcare, the hospital plays an enormous role. Health department works more on the preventive side. So it's critical that those two ends of the spectrum come together and evaluate this. And of course, Watch also being an access provider that deals with a lot of our vulnerable population was a partner in this as well. So let's talk a little bit about our primary data gathering and how we do this, just so you kind of get an understanding of the depth of this. We're required to only do one thing. We're required to either do a survey, an adequate survey that we develop as a team of experts to the community. Or we can do focus groups. And focus groups, if you're not familiar with them, is where you bring in 6 to 12 people from a location and you sit down and you kind of walk through. You don't lead them, but you walk through challenges that they may have or concerns they may have, and you gather this information. You're only required to do one. We do two. We do them both. Now sometimes that, staff groan a little bit with us on this because it is extra effort, but we think it really gives us a good capture of what we're trying to look at here for this community health assessment. So we put together 6 focus groups, and we also distributed out 1,000 or more surveys. We received 598 back. That's acceptable. We would like to see higher, but the state does no longer set a minimal end number for surveys returned. Why, I don't really know the answer to that. No one's given me the correct answer. And then we look at the secondary data, the things from the Center for Disease Control, North Carolina Health Statistics. We pull all this secondary data in. This is just a brief slide to kind of bring to point some of these elements I talked about earlier. This talks about, these are the things that this health assessment tries to pull from the community. Again, we don't leave them, we don't tell them, well, I think as Davin Madden, the health director, that this is the issue, because of course I have plenty of opinions about that, but we don't try to lead them into that. We simply ask them, what is their thought? What are their thoughts in regards to the impact on their health and wellness in the community? These are the things that we see typically under these drivers. These are very significant elements because you look at childhood experiences. See, you don't think of that typically in health. We look at housing, education, social support, family incomes, employment, just the community as a whole. And those are all those elements that come together, like I said, with safety and family and structure, and then of course access to health care. This gives you a slide talking about our life expectancy. We have just a normal distribution of ages in Wayne County. This is nothing really remarkable here, but it gives you a percentage distribution histogram here of the total population in age. Our life expectancy is 77.3 years, which is pretty good and pretty normal. This gives you a breakdown of our race and ethnicity in the community. You see our 3 primary populations are whites, blacks, and Hispanics. You see about 55% white, about 31% black, and about 10.5% Hispanic, and then we have some other Asians, Pacific Islander. Fairly common distribution of race and ethnicity across eastern North Carolina. Now this is the slide I want to take just a few minutes to talk to you about. This is the one I think as commissioners you would have interest in. You have interest in all of them, of course, but here's one that I know that would specifically be of importance to you. This gives you some breakdown of what Wayne County looks like over the past 4 years in trends. As you see, first of all, in poverty level, we have increased since from 2010 to 2014. And the reason why we have that data is because, data is always old when you're looking at secondary data. It's always a few years old as it's collected. When you look over at our median household income, it has went down just slightly, but it has went down, while North Carolina has went up. That goes back to what we said, I said earlier in my little spiel about the economics of the community, of Wayne County itself being a strong employer. And I know we're working hard as the county agency with our development alliance to really recruit jobs and businesses that pay good wages. This is so critical because you see that statistic is something that, we don't want to typically see that, but it's only a marginal decrease. So we've really been pretty stable across the 4 years, while North Carolina across the whole has only seen a slight growth. When you look at the unemployment rate, it's down across North Carolina. We are significantly down. So we're trending very similar with the state overall. And then when you look at the uninsured rate, we've been very stable there. There's a slight decrease in our uninsured rate. And there's a lot of factors that play into that. We look at the Affordable Care Act about people getting insurance, but there's a lot of discussion about the benefit to some of those elements with catastrophic plans. And then, of course, overall in North Carolina, you saw that there's a slight decrease in our uninsured rates. Another slide that I want you to take a moment to just look at some of the statistics on here. This is a education slide, and this is very critical because ultimately family unit and education are the two core blessings you can give a child or you can take away from a child. If a child does not have a nurturing environment with some parental role models and that support structure, and they don't have influence on the love of education and given the opportunity to obtain education at an appropriate level, they're starting a three-legged race already way behind, and they're missing a leg. So they're not going to achieve well. This has been shown time and time again. This is so important about education attainment as well as that family unit structure. What you see here is you see the pie graph that gives you a demonstration of the percentage of people that have advanced degrees in weighing. It's not a large number, and that's not atypical again given our location. What you do see here though is our graduation rates, I'm proud to say, have actually gone up. This has been a significant thing, even though it's still, the graduation rate is lower than it should be because only about 80% of the people that begin a cohort of students at 9th grade actually completed all the way to the 12th grade. So that means that 1 in 5 are not making it through. This is unacceptable, but still it's went up and that's a good thing. And the dropout rate we put in here just as a kind of a corollary with the graduation rate. What the dropout rate really means, if a student leaves a school, there's some data that shows that they enroll somewhere else. If they don't show up anywhere else on the radar, they typically fall under dropout numbers. Now sometimes students can go overseas or things like that and that they wouldn't get reported, and they may be in education there, so that we just put it here as a comparison level, but you see the dropout rate has had a good trend. Important findings. Next. So here's a couple things that came out of our data report when I looked at our community health assessment. The teen pregnancy rate, this is something that's always been a concern for Wayne County. It has really gone down. The wonderful efforts of concentrated focus and resources into reducing teen pregnancy, because it starts a whole process, a lot of times, of socioeconomic problems, has gone down with North Carolina's trend. We have seen that the education interventions, we have seen that the resources pumped into that has really made a difference, and teens are listening, and we're using new technologies like social media to get messages out. When you look at the disparities rate, though, which is the graph just below that, we still see that there is something, though, as much as I talk about teen pregnancy rate going down, the problem is we still have a disparate number of African American females teenagers getting pregnant. And so see, that number is significant. Even though it's dropped down significantly, you see on the graph, it's really coming down. You see the Hispanic population slightly going above that. You see that terribly high trend that it occurred over the years. So that's something you always want to be cautious of when you're looking at a health and wellness intervention for strategies, is looking at those trends. Even though the total number at the top graph shows a great reduction, you want to make sure that any particular population is not falling through the cracks. Infant mortality is another litmus test, if you will, from a health perspective about the wealth and the health of the community. What you want to see is good birth outcomes, babies brought into full term and brought in healthy and well. And so you see here that Wayne County struggled for a while. In about 2012-ish, we started implementing, we started doing improved measures. We got a grant to do some infant mortality assessment teams, and we have really worked hard, and now we're actually below the state average. It's been a good thing, because that's great, because we're having more babies born healthy, but the problem is too is that sometimes that can be detrimental to us, because we get disqualified for grants to further those programs that we put into place, and we get kind of stuck trying to sustain them on our own because we no longer have the rate as high as it is, but we still know that there was a problem that created it, and we've done good work. However, when again you look at disparities, you see that even though looking at the side graph below, you see that the number of infant mortalities that were in 2011 were significant in our African American population. They're still 3 times as high even today in our African American versus our white and Hispanic population. So that's something that we have to continue to educate young mothers about the social factors, about their health and wellness, about making sure we're getting good positive birth outcomes. This gives you a peer comparison of some counties. You see Wayne is in the gray column. So the question is always, well, how are we doing with our neighbors? How do we do? What's killing us? What's killing them? Typically across America is cancer and heart disease. So if you look at Wayne County, the number one cause of death in Wayne County is cancer. Second is heart disease, then stroke. our cardiovascular disease, and then COPD, and then go through the column. I won't read all of them. But when you look at some of our, these are not necessarily our peer counties, but these are our adjacent counties, because we thought that was important because we're all kind of in the same demographic region. We're very in line with them. So if people say, oh, Wayne County is a very unhealthy place because everybody died of cancer. Well, everybody died from cancer and heart disease pretty much across the board. I mean, so it's not like we're an outlier. Our death rates are pretty much typical for our population, and the leading causes are standard. Now, here's the problem with that as a health director. Most of these things that are killing people are preventable. They're preventable. Heart disease, cancer, cardiovascular, cerebrovascular, all these things, they're very preventable with our lifestyle choices, our diet, our exercise, the things you hear me talk about. And everyone goes, oh, God, here he goes again with this mess. But these are the things that can stop these deaths. It's amazing how we have a hard time working with the behavior modifications. The studies have shown that I can teach you, I can talk to you, I can preach, I can sing songs, I can even do a little jig up here if you want me to make it seem more interesting. But it takes 44% of the impact of these things are based on individual self-behaviors. 44%. It's the most significant element that impacts whether you're going to die from heart disease or cancer at a premature rate based on your decisions. Thank you, Carol. Here's gives you gets to break down because everybody goes, what kind of cancers are killing us? Well, unfortunately, lung is still the killer. Now, we've worked hard about working with smoking cessation. This is tobacco country. I respect that. I understand that. Put a lot of people through college. I've built a lot of houses and farms and families, so I'm definitely sensitive to the agricultural side of it. But unfortunately, it's also killing a lot of people still, even to this day. You look at when you look at some of the other deaths over there, there are a wide variety of different types of cancer, from bone cancer, melanoma, etc. But you see that the big one is 398 deaths that occurred were due to lung cancer from 2009 to 2013. So 400 people. Again, many of these are preventable based on lifestyle choices and behaviors. Just some risk factors. You just take a quick look at this because I'm moving on, about to get ready to sum this up. You see that these are some of the things that, again, when you look at these risk factors, let's look at hypertension, smoking, obesity, unhealthy diet, physical activity. All these things most of these things have an impact that you can influence. The impact on your health are influenced by what you do. You might not can change your family history, and you certainly can't change your age, but you can change a lot of the other elements that impact your health. HIV and sexually transmitted disease, this is always a hot topic because people don't want to necessarily know what your disease rates are here in Wayne County, but I want to show you that with outside of that old culprit chlamydia, which always seems to just rally the troops and always stay high, gonorrhea and HIV and syphilis we've seen a reduction in those rates over the past several years. This is a good thing. This has got a lot to do with our intervention strategies, education, and trying to change behaviors, but again, chlamydia is one that we just have a hard time getting a handle on. Here's mental health admissions. I want you to see this one because this is, again, talk about our funding. If you look at the these are emergency department mental health admissions. If you look for the North Carolinians in the green, we see there's been a little slight increase, and it's fairly stable. But you see Wayne County, we've seen a constant growth in mental health admissions. This is going back to the fact that we're finally getting to the point, we know that the LME system and the mental health system has had bumps and bruises over the years. A lot of questioning about how effective it has been in capturing people in that safety net and treating them properly and getting them back out so they can be functioning adults to work in their community and operate. However, with that being said, we're still seeing a lot of people that are just diagnosed with valid mental health disorders that have an impact on them, and the treatment sometimes can be challenging. Crime rate. Talk a little about this. This is one where we see it in the paper all the time about the murders. I want you to know that Wayne County definitely has crime, and we all are well aware of that. If you see it's higher, our crime rates are higher than the North Carolina average. But if you look at the trend data, and it doesn't lie, crime has went down significantly over the past 7 years. About 5 to 7 years, we have seen a reduction in their crime rate. So this has been good. It is a safer place. And we know that there's always more work needs to be done, and in the community that are exposed to those isolated areas of higher crime, they may not feel that, but in general, it is a safer place to live, and the crime rates have gone down. County health rankings, I'm going to skip through that one. For the sake of time, that one, let's get through. Okay, what are our areas? Out of the assessment, this is what we focused on. We could have focused on mental health, we could have focused on substance abuse. They were recognized in our assessment. We still think they're a priority, but when it came down to it, healthcare access, education, and health conditions are our focus areas. These are the areas that, as a community, people should look at putting their strategic alignment and plans with, because these are the ones that have the fundamental impact on where we're trying to get to with a healthier community. This gives us a little process step that I won't bore you with. Next.
Oops,
Other way.
sorry.
All right. So ask your question is, what are we doing? Well, what we do after we do this is we develop action plans with our community partners. We look at areas for improvement, and we try to use that to, and we don't just do it ourselves. Again, when you see these issues that are recognized as disparities I talked about, and also the good things we can pat ourselves on the back about, like the teen pregnancy rate and crime. The point is to stay focused, to continue the good work that we do, but also to look at, use this document as a guiding tool for all of our partners that are looking to have, part of their mission is the health and wellness of the population of Wayne County, for grants, for strategies, to look at areas that they may have not put their priorities in the past, and they put their priorities in the future. Thank you for your time. That concludes my presentation.
Questions? Comments?
Are you willing to take questions?
Sure. I'll take
John's done.
I have.
I might not be willing to answer them, but I'm always willing to take them.
On the mental health side, do we count all mental health or just pick out the Wayne County one? Because we get a lot of people from other counties because of Cherry Hospital and other
No,
entities.
those reports would be just specific to who's checked into the ED at Wayne, UNC Healthcare Wayne Memorial. So it doesn't necessarily mean it's a Wayne County resident. It's everybody that comes in.
Okay.
Does that answer your question, Mr. Bell? They're not all, that's not just Wayne County residents. That's the number of people that went into the ED with a mental health issue at the hospital.
Right. The reason I asked that question because a lot of people get out at Cherry and they stay in the local area.
Yeah, that's correct. But those still are part of our community.
Yeah.
And you know, regardless of where they're from originally, you know, that's something that we get basically faced to deal with in the challenge of how to get them referred out to appropriate sources to get them stable, make sure their medications are being kept. What we see, one of the biggest issues is noncompliance of medication use. And you talking about drug testing earlier, I'll just bring up one little point to you. It's very interesting. Right now, North Carolina, unfortunately, is the leading state in the nation for chronic opioid painkiller prescriptions. 97 prescriptions per 100 people in North Carolina. Now, that doesn't mean everybody's got a pain medication prescribed. Some may have 3, some may have 8, some may have 12. But right now, North Carolina, and that guidance has been changed through the CDC, and hopefully we'll see a recovery, start seeing improvement. But right now, there's 97 chronic disease prescriptions per 100 people in North Carolina. That makes us the leading state in the nation. Huh?
It's like a lot of doctor shopping to me.
That plays an important
That's
role.
high.
It
That's
does.
high, that's unacceptable, that's high.
Mr. Chairman, can I ask a question? Do the African-American statistics include the Haitian population down around Mount Olive, or are they under the other category?
They are under the other category.
Other category?
They are, yes.
Okay, thank you.
I did have a question. You've done a phenomenal job in regards to reducing infant mortality. I mean, and I understand what you're saying in regards to grants. My question is, do we have the resources to sustain those programs that evidently brought that drop into being?
Well, honestly, I think we do, as long as our funding that we currently use now at least stays steady, stays equal. If we begin to reduce those fundings, both from the state, and that's part of, you know, the issue. A lot of these programs work on grants, and they work on subsidy from the county, and they also maybe work on some additional revenues through fundraising or state monies. Since there's so many pots of money that comes in to maintain and sustain those programs, that's where it's always a fickle outcome. And to answer your question, Mr. Doctor, directly, is, you know, yes, now we do, but that could change from year to year depending on a decision made at the legislators, or it could be made here locally. All these decisions could have an impact on whether these programs continue to run at their level or not. So that level funding, if we stay where we are today, I think we do with potential to grow is always there, but yes.
Well, just for some clarification, if I'm understanding, you got grants, allowed us to implement programs, the infant mortality rate dropped, but once you drop below the state average, is that tying you to where you no longer are getting the grants?
We do not qualify for some going forward, yes. Sometimes when the state will see these infant mortality rates, they'll set aside money to go towards interventions, and last year they did that, and we did not qualify for the funds. We
Well,
lost.
we just don't want to see those rates going
We don't want
back
to see them
up.
go, we'd rather going down, but I'm
Right.
saying it puts you in a kind of a place where you're doing great, but you don't get any more additional funds to continue your work.
Sure.
Okay, thank you.
Get punished for doing well.
We know the feeling.
Yeah, I know, I'm serious. Think about that little well. Any other questions? Thanks, sir.
Thank you for your
Thank
time.
you for coming over.